COVID-19, the invisible war that changed humanity. It began with a cough, a fever, and a silence that would echo across the entire world. In late December 2019, in the bustling city of Wuhan, China, a city of over 11 million souls, life went on as usual. Markets crowded with vendors, children laughing in parks, factories humming with production. The streets were filled with people preparing for the New Year celebrations. But in the heart of the Huanan seafood market, something was brewing, something invisible, something ancient, something alive. Doctors began noticing a strange illness spreading among patients, a fever that wouldn't break, lungs filling with fluid, and a shortness of breath that grew worse by the hour. At first, it was dismissed as pneumonia. Then came the first whispers, a new virus. Unknown, unpredictable, unforgiving. No one knew it yet, but the world was standing at the edge of an abyss. By early January 2020, doctors in Wuhan were overwhelmed. Among them was Dr. Li Wenliang, a young ophthalmologist who tried to warn his colleagues through a private chat group. A SARS-like virus is spreading. Be careful. For that warning, he was silenced, accused of spreading rumors. Weeks later, he himself would fall ill from the same virus he tried to warn the world about. As his condition worsened, he posted one final message to the world. A healthy society should not have just one voice. On February 7, 2020, Dr. Li Wenliang died. He was 33 years old. His death became a symbol, the first voice lost in what would soon become a global catastrophe. By mid-January, cases began appearing outside China, Thailand, Japan, South Korea, then Europe, then the United States. The virus, later named SARS-CoV-2, was no longer a local outbreak. It was airborne, invisible, and unstoppable. Airports became silent, borders closed, flights grounded, entire cities locked down. People watched in disbelief as countries shut their doors to the world. Something that had never happened in modern history was unfolding, a planetary pause. In March 2020, the World Health Organization made the announcement the world dreaded. COVID-19 is now officially a global pandemic. The words echoed across newsrooms, televisions, and cell phones. Panic spread faster than the virus itself. Supermarket shelves emptied overnight. Streets fell silent. The hum of modern civilization, traffic, laughter, noise vanished. For the first time, humanity collectively stopped. Hospitals turned into war zones. Doctors wore layers of protective gear, their faces marked with deep red lines from masks that had to stay on for 16 hours straight. Patients gasped for breath, isolated, unable to see their families. Nurses held up phones so loved ones could say goodbye over video calls. The world witnessed images that would stay burned in memory. Army trucks carrying bodies in Bergamo, Italy. New York hospitals overwhelmed. Mass graves in Brazil. Streets in India filled with sirens and silence. Everywhere, the air smelled of disinfectant and fear. But even in the darkest hours, humanity fought back. Scientists worked around the clock. Laboratories collaborated across borders, languages, and politics. In record time, less than a year, multiple vaccines were developed. Pfizer-BioNTech, Moderna, AstraZeneca, Sinovac, names that became synonymous with hope. It was one of the fastest scientific achievements in history, proof that in chaos, humans could unite for survival. Yet, even hope came with division. Some refused vaccines. Conspiracies spread online like a second virus, invisible, contagious, and deadly in its own way. The pandemic became more than a medical crisis. It was social, political, and psychological. It exposed humanity's strengths and its deepest fractures. Lockdowns brought both peace and pain. Skies cleared as pollution levels dropped. Dolphins returned to once busy harbors. But homes became prisons for millions. Domestic violence surged. Mental health collapsed. Children learned from screens. Weddings, funerals, and graduations happened over video calls. People lost jobs, dreams, and years they would never get back. A silent grief blanketed the planet. Then came the race for survival. Masks became symbols of both protection and politics. Essential workers, doctors, nurses, delivery drivers, grocery clerks became the heroes of a war they never volunteered for. They faced exhaustion, fear, and death daily, yet kept going. The phrase, "we're all in this together," echoed across the globe. But truthfully, we weren't. The pandemic revealed how unequal the world truly was. Rich nations bought billions of vaccine doses, while poorer countries waited months, even years, for fraction. By 2021, over 150 million people had been infected. By 2022, more than 6 million lives were lost. But behind those numbers were faces, mothers, fathers, children, doctors, strangers, gone too soon. Each loss left an empty chair, a quiet room, a name whispered in memory. Funerals became live streams. Cities became ghost towns. And yet, amid the sorrow, something remarkable happened: resilience. Communities found ways to help each other. Volunteers delivered food. Artists sang from balconies. Scientists shared data. Humanity, once again, remembered what it meant to stand together. As restrictions eased, people stepped outside for the first time in months. The world felt both familiar and alien. Masks covered smiles, but eyes met with gratitude. Airports reopened. Classrooms filled. The sound of laughter slowly returned. But the world was changed forever. Economies were scarred. Millions of businesses gone. Governments restructured. And a new phrase entered our vocabulary: the new normal. Handshakes turned into nods. Offices became virtual. Health became the world's greatest wealth. We realized how fragile our systems were and how interconnected our fates had become. By 2023, the pandemic began to fade into history. Vaccines, treatments, and natural immunity finally pushed the virus into a manageable state. But its legacy remained, a reminder that the smallest organism on Earth can bring humanity to its knees. COVID-19 was not just a virus. It was a mirror reflecting our fears, our weaknesses, our compassion, and our capacity for survival. It taught us that science saves lives, that truth matters, and that unity is not optional, it's essential. We thought we controlled the world, but the world reminded us how small we truly are. The invisible war left no victors, only survivors. And as the dust settled, the world took a collective breath, carrying the scars of what it had endured. Because some wars are fought with guns and fire, others with silence and breath. And this one, the war against an unseen enemy, changed humanity forever.